to my podcast, Autumn is Here. I'm Francine Crawford. Thank you for tuning in this evening. Today, we're talking about living arrangements. Now, some of you are seniors and may not have thought about your future and if the possibility of you staying where you're at, or maybe sometime in the future you need extra help and you may have to have assistance. That is something that we can think about now, even before we get ill, and hopefully we won't get ill, but if we do, or also for the children or the spouse to think about how to take care of aging loved ones. So right now I'm going to give you some options because when my mom got sick, the doctor told me she has to go in a nursing home. It was like that was the only option. And I didn't understand that. That was like an extreme to me. So it put me in a panic. And then I started trying to think about different places. One of the things, of course, I thought about is like trying to rearrange my schedule, trying to figure out how I could stay home because I happen to be fortunate enough to live with my mom. But that I was working full time, so I really couldn't do that. So I started thinking maybe a family member. Now that's also an option to you. If there's a family member, maybe that just retired or, maybe their grandchild that's in school or something like that, maybe they can look in on your parent and things like that. So those are other things that you can think about. If it's sometimes there are people who are nurses and they retire and sometimes they might want extra work. So that's another option for you to think about. So you can do something where someone that you know takes care of your parent for half a day or whatever. And then this way they can be in touch with you and you can be in touch with them. And those are other options. There also are options like assisted living. Now, assisted living, I never heard of that until I had to look for a place. And when I looked for a place, I realized that assisted living was extremely expensive, at least for me. It was $3,500 to $4,000. And that was in, 2006, 7, something like that. And they are there for seniors that can kind of get around, but they have nurses there. Sometimes some of them, all of them are different, but they have nurses that will give you medicine and things like that, check up on your parents. Your parents will have to come down. Most of them, they will come down for at least one meal a day, if not two, but they will serve all 3 meals, things like that. Some of them have cleaning, housekeeping services, depending on whether it's in that amount or not. It depends on the facility. That's something, if you're going to look for assisted living, look for what is in the base price and then all the add-ons, because some of the add-ons you may need, some of the add-ons you may not need. Maybe you wash the clothes or whatever, or clean up, or you'll visit and you'll do those things. But sometimes you have to look for the things that, the little things, okay? And if you can't afford that, that might be a nice option. A lot of the places are pretty nice. They usually have nice grounds. They usually have different activities for seniors where they'll have bingo or a card room or a reading room. And then sometimes it's good to have them in an atmosphere around other seniors. So that makes them feel good every now and then. They can talk to, somebody their age. My mom, you always say, I want to be around people my age. I want to be around people my age. I'm tired of you young folks. So that's something that you might be able to consider. Just know that that's available to you. But, it's good to look into these things early to just see what you can afford and see the facility, go visit the facility. And there's also, of course, you can relocate your parent, think about that, but that's something that you should have a conversation with them beforehand, if that's possible, if they want to live with you. If you don't live with your parent, you live in another state or on the other side of town or somewhere else, you can always consider relocating them. Now, if you take care of them, there are also option that you can have a respite. Respite care is when you are taking care of your parent and you might need a break, or you have to go to your child's graduation, which is in another state, for a weekend or 4 days or something like that. Respite is a temporary care facility where you can take them to, where you can have a break. You don't even have to be going away. You can just, need a break for whatever reason and do that. They may keep them for a week. And it all depends on the care that you need. If they really need a lot of medical attention, there are different places for that. Some just need care. And some respites have someone come into your home to stay for that week or that couple of days and give you a break. So those are options to you. And again, those are options that I didn't know that was available at the time. Of course, you have a nursing home. If it's something severe or you cannot take care of them, you're unable to take care of them, depending on their needs. If their needs are a lot of medical needs that you are not equipped to do, you may consider a nursing home. Please consider certain things with a nursing home is that if they are qualified for a nursing home first, if they're qualified to be in a nursing home, just know that, and this is for seniors too, just know that you have to spend down your assets and the money that you have before the state will kick in or the government will kick in. So if your parent has a large sum of money or a lot of property or things like that, you have to consider that the government's not just going to take over when they go into and pay when they go into the nursing home. They're going to attach their assets and see if, liquefy everything that they have and see how much they have and draw down on that. And they'll slowly do that until, and if they don't have anything else left, then that's when the government will kick in. So please consider that. And while you're considering that, that's why I said these things you have to think about now, because if you don't know that, while you could have planned earlier. It's usually 5 years prior to your loved one or a parent or you getting ill. If you have changed your name on your home or you're giving gifts to your children, I think there's a limit of, probably in New York, I think it was about $13,000 that you can give them a year. Just slowly start thinking about things like that. And sometimes it's kind of overwhelming to think about. But if you think about it, say if you're 65 and you're healthy and you have this property, you worked all your life and you saved all this money and you have all this property, things like that. If you start thinking about how to dole it out before you get ill, by the time you get ill, at least they will have something. If you are so ill that you have to go to a nursing home and they have no choice, if it's a year or 2 years into your illness and you have to go to a nursing home, then you cannot any longer give them money without it possibly being penalized, and the state may come back for it. But if you do it ahead of time, as it could do it early. You can do it 10 years before. No one knows when they're going to get ill, but you can do it early if you want. But that's the thing, the good thing to plan out, gift your assets. There are other ways you can make sure that all your money doesn't go to the nursing home, but you should look into that. You can get a lawyer and they can tell you your options. There are other options. There are options where you can put your house in, I believe it's called a life estate. And this way that if something should happen to you, the next of kin or the person that you wanted to go to, it will just transfer over without the penalty of being charged with the nursing home fees. So those are things that I wanted to talk to you about and just give you some information on today. And also today we're going to talk about a home attendant. Now that's something that many people do look into and is very helpful for people. And today we have a guest that's going to talk to us about home attendant care. How do you get a home attendant, and what's the qualifications and different things and different questions. So today we do have a guest that's going to talk to us about that. So that's another option. Okay, well, thank you very much. And just let's welcome my guest. Hello and welcome to Autumn is Here. We'd like to welcome our guest, Miss Lizette Smith, who is the former Executive Director of the Bushwick Stuyvesant Heights Home Attendant Incorporated, and she is a registered nurse by profession. Hi, welcome to my show.
Hi, thank you for having me. That's a mouthful, isn't it?
Yes, it is.
Yeah.
Yes, yes. Well, if you live a long time, I guess you do a lot of things. So you have a lot of hats, which is a good thing.
Correct,
The good thing.
correct.
So I'm glad to have you here this evening. And I'm sure you have some good information for us. So let's just get started. Can you just tell me a little bit about your job, your former position?
Okay, well, Bushwick Agency is a licensed home care agency in the heart of Bed-Stuy, Brooklyn, in New York City. And the agency has been in existence since 1981. So we have a lot of years in this profession, taking care of people and just helping people to remain at home and be healthy.
So how are you funded? How are you funded? Can you just walk in and say, I need a home attendant?
A person can do that.
You can.
All right. And they can do that, but at that point, we will direct them and let them know what they need to do. So in order to receive services from our agency, you have to have Medicaid. Okay. So if a person walks in and they have Medicaid, it makes it that much easier. We can guide them from that point on.
Okay. So they would have to apply for Medicaid.
Exactly. If they don't have it, they have to apply.
They have to apply for it. Okay. So how many aides were you responsible for? Like how big is this agency?
The agency, well, a few months ago, the agency had a census of about 300 and almost 400 clients, and we serviced them with about 500, almost 600 aides.
Oh, okay. Well, that's a lot.
It is a lot. It's a lot to manage.
It's a lot to manage. Okay. So how do you do that? Because it is a lot to manage, and when you're dealing with people and their care, you have to be very careful. So I'm sure there's some kind of training or regulations or something. So how does that work? Are they trained, and how skilled are they?
Yes, the aides are trained. They all used to be PCAs or personal care assistants at one point. And then regulations changed and everybody had to be upgraded to be a home health aide, which requires more training. So they all had to go back to school, except for the ones that came to us as a home health aide already. The training for home health aide is usually about 76 hours, and that's over a period of usually about 3 weeks. They have classroom time, and then 1 day is spent on clinical. Whereas a personal care aide, their training is usually 7 days, and it usually lasts over the course of a 2-week period. And in those 2 weeks, they have classroom and clinical. So they usually have, they're integrated as opposed to the home health aide, where 1 day is clinical and they're graded in all of their skills.
Okay, so when you say 1 day is clinical, tell me what that is.
Clinical is they check to make sure, now this is for the home health aide, they make sure that they know how to take a blood pressure, how to take a pulse, how to check the patient, or we call them a client, not a patient. Take the client's temperature, how to reinforce a dressing, not change a dressing, but to reinforce it. And that's basically it. Look for signs and symptoms of medication reactions so that they can report that to the nurses who work at the agency. But now you mentioned before that that's a lot of people to manage, but we have case coordinators at the agency that are responsible for making sure that the aides get their assignments, that they log in and they log out at the end of the shift.
Okay, so if they have a client that needs a little bit more service, say they get there and they need a little bit more than changing their dressing, or they see something, they will call the agency, and then the coordinator will assign a nurse to to assess them or visit.
Yes. Well, the coordinator would let the patient, the director of patient services, who isn't a registered nurse, let her know. And then that she would communicate with the nurse for that client to make sure that the nurse addresses that issue. So it may require a little more training in the home for that particular aid on that client. Yeah, so all of the clients do have a plan of care, and every plan of care is individualized for that particular client. And that plan of care is done by the registered nurse that goes out to visit that client once every 3 months. And that's the person that would go back to the client if there's any issues, like, if the client falls, if there's an issue in the home, that nurse would be notified and would take care of that.
Okay. Now, is there any regulation with the state? Who oversees your company?
Okay, so the state is the overseer because we're licensed under the state. So the Department of Health comes in at any time they wish to. If they may get a complaint, and that may bring them to the agency, or they may just come randomly to the agency and they check files. They make sure that all of the things that the aides are supposed to have, they have in place. And that has to be evidenced on the file. All of the things that we're supposed to have or do for the client is evidenced in the client's file. So they just show up. We have a contract. We have a contract with Human Resources Administration, which is directly through HRA and Medicaid. Mm-hmm. So they also come out, but they usually let us know when they're coming. But they send monitors out to the agency to check on the files, check on our policies. They also send quality assurance monitors out to the client's home, and they don't let them know that they're coming either. So they check to make sure that there is a plan of care in place, that the aide is in place, the aide is doing what she's supposed to do.
So there are safeties in place, because we've heard, some stories where things didn't work out too well. So it's good to know that there's safeties in place where the state actually comes in and does a regular routine examination of the company and what's going on. So
exactly.
Okay.
Exactly.
Okay.
And, we also, when the nurse goes around to do her initial visit to the client, when the person comes on as a new client, we give them an informational packet, and that packet lets them know that if for whatever reason they're not happy with the service that's being provided to them, if they're not feeling comfortable with the aide, or if they feel that the aide needs more training, or whatever it is, we encourage them to call the agency and let us know that, so that we can make an adjustment. Whatever that adjustment needs to be, right, we do it.
So it seems like a very rewarding job. How, if somebody was interested in becoming a home attendant, what would they have to do?
Okay, they can go to a training program. New York, in the 5 boroughs, they have numerous home health aid training programs, and they can go and they can register and become a home health aid. And they're not for free, so they have to pay for that training. The agency also has a way that if the person comes to us and expresses that they would like to work with our organization and become a home health aide, we have ways and means to send them for training, but then they have to work for us for a certain period of time. And in terms of their certificate that they would get at the end of training, we hold that certificate until that time, until they've served that time, and then we give it to them.
So how long is the period of time? How long is the certificate valid for? Like, do they do this every year?
They don't have to, the certificate doesn't have an expiration date. So it's
Okay.
valid.
So
Okay.
how do they upkeep on training, and how are they, like, if they're not recertified or they don't
Right.
have to be recertified, how do they continue to grow in because things change, the way you
So,
take care of different things, the way you lift the person maybe change. So how do they keep upkeep with the treatment of people?
so the agency has to provide for a home health aide 12 hours of continuing education a year. So every year they have to come into the agency and they have in-service classes, and we keep them up to date with the training that they need. So for home health aide, like I said, it's 12 hours. And for personal care aide, the continuing education is 8 hours, 8 to 10 hours. But what we do at our agency is everybody gets 12 hours.
Mm.
Okay.
Okay, so can you tell me a little bit about the difference between Medicare and Medicaid?
Okay. So Medicare is a federally funded health insurance plan or coverage for people who reach the age 65 and have, actually paid into that system by working. So when they turn 65, they're eligible to receive Medicare benefits. Or if they're younger than 65 years old and they have a severe disability where they're not able to work, they also would qualify for Medicare. Medicaid is also a federally run or funded health insurance plan, but it's also state. So each state has their own qualifications for Medicaid. All right, so Medicaid is also, like I said, it's federally and state funded health program that provides health insurance for low income people.
Okay. Okay.
All right. Now, there's some
Medicaid.
people, yes, but I need to add also that some people are what you call dually eligible. So they qualify for both.
Okay.
And in that instance, it's a great thing because having both Medicare and Medicaid enables the person to, maybe get medications at a lower cost. So their health coverage would be at a lower cost and they have more available to them.
Okay. So, like you said, your agency is covered through Medicaid. That's how they would be paid. Okay, so
Yes.
you would have to have that.
Yes.
Okay. So the qualifications for that is based on income, because say if you worked all your life and you have property and you have money in the bank and things like that, will you still be able to get Medicaid? Will you qualify for Medicaid?
You won't qualify for Medicaid
Okay.
because you'll be over whatever that income limit is or that assessment is in terms of what assets that you have.
Mhm.
You have to fall below that level in order to be eligible for Medicaid. Now, sometimes what people do is they have what they call a spend down program, where the person must spend down whatever that amount is that they're over that limit for Medicaid. Once they spend that amount down, then they become eligible. So if they're enrolled in that type of a program, along with the Medicaid, then they would be eligible.
Okay. Okay. So that's something to consider.
Something to consider.
That's
yes.
something to consider. Okay.
Mm-hmm.
Awesome.
The other thing the other program they have is called a pool trust.
What is that?
So a pool trust is where, let's say the limit for Medicaid is $500, but you have $600 as your income. So you're $100 over what the minimum is. So that $100 would go into a pool trust account that would be managed by another organization. And out of that $100, they would pay the person's bills for them. They would take care of some of their responsibilities, but they would still maintain that $500 for themselves to also live off of.
Oh, okay. Okay. I've never heard of that.
Yeah,
Okay.
so that's called a pool trust.
Well, that's good to know. That's good to know. Good. But how long did you work with the Bushwick Stuyvesant Rights Organization?
About 30 years.
30 years. Wow. Wow. That's
Yeah.
great. That's great.
And in fact, I had hair when I started working.
Well, I don't know. Is that a good thing now? Are you saying that? Did they take your hair?
In the course of that 30 years, I'll tell you, it's a lot. It really is. It's a lot of responsibility, just being responsible ultimately for the clients, for their families and their well-being, because whatever goes on inside that client's home, it's going to affect the client, and it's going to ultimately affect the aid in there as well. Listen, that client is supposed to feel that for those 4 hours or 8 hours or how many ever hours you work with them, they're the most important person for that amount of time.
Most families, do you find that they're helpful with the situation, or do you have to be the liaison between the home attendant and the family? Is it some people don't like someone else coming to care for their loved ones, and sometimes they give you a hard time, or are people just really receptive to it?
People are not always receptive to it, especially a client. You know, nobody likes to feel that they have to depend on someone else, you know, because we're just creatures of habit. And, you know, it's like we're supposed to be independent. But when you get to the point that you need a little help, I guess the first thing you have to get over, that first hurdle, is accepting the fact that you do need some help. Some families, you know, we get a mixture. We get some families that are so helpful, and we wish we could clone them and just have every client and every family, you know, it's like a model case, you know. Then you get some where the client has nobody. And, you know, that's a little more challenging, you know. Sometimes we get families that are jealous because the client they see a change in the client for the better, you know, and you would think they would be happy about that. And I think part of them is happy, but a part of them just feels that the client is closer now to this person coming in every day. They look forward to seeing them every day, you know, and then we have to deal with the issues with that as well.
You don't have to have an aide for 8 hours for 5 days a week. You know, right. They can still have some independence. You can have an aide for, you know, 3 times a week when you need them. And then, you know, the rest of the week you can do what you can do for yourself and things like that. So don't feel like you're giving away all your independence. It's for assistance. So everybody doesn't need somebody every day for 8 hours. And also, of course, that's with qualification also.
Right. But the thing is, the client is not the one that determines that. So the doctor, the client's doctor, is the one that actually, you know, starts the ball rolling, and just saying that, well, this person does need the assistance and they need it in certain areas. And then it's the person that goes out that determines the task. And each task is assigned a certain amount of time. Okay. So according to that time, that's how they come up with how many hours per week that client is going to need. But let's say the client, they determine that the person needs 8 hours, 7 days. The person still has the ability to say, but I don't want that. I don't want anybody on the weekend because my family is here on the weekend, or I just need some time by myself, or I go to church Sunday. I don't want service on Sunday. They have the right to do that, and we have to respect that. Mm-hmm. The only thing we have to make sure we do is make sure that we document that.
There are certain agencies that you can get home attendants, and it's a private client. You can pay yourself. So you have that ability that if you can pay, you can go to certain agencies and you can also get this care. It's not that if you don't have Medicaid, then you can't get care. So there are other places where they're private. You can privately pay to get help. Right.
Yes,
okay.
Yes. Mm-hmm.
Okay. Well, thank you so much for all your information. We appreciate it. is there anything else that you would like to say about your job, or how rewarding it was, or, just say to the audience some information that might be helpful?
I know that right now, COVID has really left its mark on so many businesses, ours included. And across the board, agencies right now are struggling to get people to register to help us to care for the clients that need it. So I would just invite anybody out there right now that that feels that they have the compassion to deal with people in their homes. And, it could even be someone who's retired that might want to do a few hours a week, that retirement is just not getting it for them. We welcome you guys to call us. Call us at Bushwick Stuyvesant Heights Home Care, and allow us to, just get you in a position where you're going to feel rewarded that you were able to come and take care of somebody and just bring a little sunshine into somebody's life for a day or so. And we're also looking for clients as well. So if you know somebody that, maybe in your neighborhood, in your church, that needs the help, definitely call us, because we love to be a part of your everyday life and just make sure that they're safe.
Okay. Well, thank you, Ms. Smith. We appreciate that. And thank you for taking the time to speak on our show. And I'm sure there's very helpful information, and someone in the audience will be blessed by it. So thank you again.
Thank you for having me.
Well, thank you so much for tuning in this evening. I hope there was a lot of information that will help you about living arrangements and give you some ideas of what to do. Remember, every state is different. Every organization is different. So please do your due diligence and look into it. Listen, Google is your friend. You can Google all kinds of information if you know where to go. If you want assisted living, or if you want a nursing home, if you just want a home attendant. If you need the information about Bushwick Stuyvesant Heights, here it is. If you need home care services from them, they're 992 Gates Avenue in Brooklyn, right off Ralph Avenue. Or if you want to be a home attendant, you can give them a call at 718-453-8400. So thank you for tuning in, and till next week. Good night.